Good morning. So, in case the anticoagulant, in our next part, we are going to discuss on the heparin. Now, heparin is a non-uniform mixture of the straight-chain mucopolysaccharide with molecular weight 10,000 to 20,000. So, heparin is a non-uniform mixture of the straight mucopolysaccharide with molecular weight 10,000 to 20,000. It contains the polymer of sulfated disaccharide unit. Now, if you remember that already we have told that this heparin is one of the important anticoagulant because this particular heparin it is also used as a in vivo and also as a in vitro. Now, what are the you can say that after administration it will bind to the endothelial cell surface membrane. Clear? Endothelial cell surface membrane. Now, what are the you can say that site of action of the unfractionated heparin? We can see. So already you know that intrinsic factor and extrinsic factor we have already discussed. Now, in this case, we can say that what is their site of action? Activation to 10 you can say that 11 to 11a activation. Activation of the factor 11. So in this factor 11, factor 12, next is activation of the factor 9. So in the factor 9 it is going to be you can say that is the probable site of action. Now major site of this it will be includes here activation of the 10 factor 10. So activation of the factor. So they are inhibiting the activation of the factor 10. Also major site is factor 2. Activation of the factor 2, that means thrombin. So activation of the thrombin also it is inhibiting. So heparin major site is the inhibiting the activation of the 10A and thrombin, and minor site it will be include the activation of the 12, 11 and the 9. Factor 12, factor 11 and factor 9. Now, if we see about this mechanism of action of the heparin. Now, heparin, if we see about this antithrombin 3, antithrombin 3 and the thrombin. So, heparin binds to the both antithrombin 3 and thrombin to form a that is ternary complex. So, it will bind to the antithrombin 3 and the thrombin. So, heparin activity dependent on the plasma protease inhibitor antithrombin. So, it is a activity, it is depends on the antithrombin 3 which is a plasma protease inhibitor. Antithrombin 3 inhibitor of the clotting factor protease. Yeah? Antithrombin 3 it is the inhibitor of the clotting factor protease inhibitor forming 1:1 stable complex. Clear? 1:1 stable complex. So, complex forming reaction normally. This complex forming reaction is normally slow, accelerated by the 3 orders of magnitude, almost 1000 times by the heparin. Now, accelerated mechanism, heparin's binding induce a change into the antithrombin. Heparin binding induce the change into the antithrombin to form, resulting into the increased complex formation activity. Now, here we can say that heparin inhibit the acid phospholipase as well as it will activate the antithrombin. After the activation of the antithrombin, it will you can say that it will cause the inhibit the prothrombin to thrombin formation of the prothrombin to thrombin. If there will be the you can say that inhibition of the prothrombin to thrombin, so finally it inhibit the fibrinogen to fibrin, which is insoluble fibrin. So there will be no clot formation. There is a no clot formation. Now, heparin it is act as an anticoagulant, preventing the formation of the clot, extension and existing clot within the blood. Heparin is generally used as an anticoagulation for following conditions. So, what are the conditions? Acute coronary syndrome, arterial fibrillation, deep vein thrombosis and pulmonary embolism. Then you can say that cardiopulmonary bypass for heart surgery, during that it can be used, and hemofiltration, and also the inducing of the central and the peripheral venous catheter. So in such condition also they are going to use. Common side effects include the bleeding, pain into the site of the injection, low blood platelets. And serious side effects include heparin, includes thrombocytopenia. Greater care is needed for having the poor kidney function. So these are the things we need to take care of, means take into the consideration for the heparin use.